Is there a way to prevent Alzheimer's disease? It's the question so many people, doctors, and scientists are trying to answer, along with the woman you're about to meet. On today's All Things Brain Health, see what she's doing to protect her brain health. Good morning, I'm Alexis Del Cid, and welcome to All Things Brain Health. For Nancy Jackson, Alzheimer's disease hits very close to home. She's only 59, but her mom was diagnosed with it 2 years ago. And now she's doing everything she can to try to prevent it from happening to her.
At 59 years old, Nancy Jackson is on a mission.
We're almost to the hill.
Her mother was diagnosed with Alzheimer's at age 85. Watching that decline reshaped Nancy's outlook.
I may be destined for Alzheimer's. I'd like to forestall it as long as I possibly can.
Nancy has turned prevention into a daily priority.
Intervals are great because they wear you out and they're more effective faster.
She's lifting weights, rucking with a weighted backpack, tracking her sleep, and committing to at least 3 high-intensity workouts each week. She's prioritizing what her body needs.
Sleep and exercise, honestly. I mean, everything that I've read indicates that just staying truly active and keeping your metabolism kicking is incredibly important.
She follows a Mediterranean-style diet, adds supplements, meditates, and even squeezes in sauna sessions. She also keeps her mind active through work, reading, and learning new skills. But Nancy admits it's not always easy.
There are so many recommendations, and I think you can make yourself a little crazy in taking all of them, right? Which currently I'm sort of trying to do.
Dr. Jeff Burns is co-director of the KU Alzheimer's Disease Research Center. He diagnosed Nancy's mom. Nancy says she feels incredibly fortunate for all of the work Dr. Burns and his team is doing for Alzheimer's research and prevention, not just for those who live in Kansas City. Nancy's mom lives in Salina.
Dr. Burns and his crew, in terms of really providing care, are ambitious and dedicated to reaching across the entire state of Kansas. So they've been working with primary care doctors across the state for years now and are looking to step that effort up.
Dr. Burns points to studies showing half of all Alzheimer's cases could be prevented or at least delayed by 5 to 10 years through healthy habits. Nancy hopes she's buying herself more time.
If we could just prevent the onset. So nearing 60, I'm in that zone where it becomes really important, every little bit that I can stave off.
For Nancy, the fight against Alzheimer's isn't just about her future. It's about honoring her mother's journey with patience, dignity, and love.
And I'm trying to make clear to her on a regular basis what she's contributed to me, what she contributes every day. Helping someone who's struggling, knowing that they're losing their memory, is a really worthy pursuit. And it's not easy, but it is incredibly rewarding.
We're so happy to have Nancy joining us this morning. And Nancy, it's beautiful how you tell your mom what she's contributing.
You know, it's interesting because I think when someone is struggling with the words that they cannot find and they're looking for the memories that aren't available to them, they feel like their value is diminishing.
Yes.
And it's so important to say, no, Mom, it's all still there. You're still there.
Yeah.
But it's hard.
Because it's crushing when they start apologizing for this disease they have that they have no control over. We're going to dive into your experience and talk more about your mom throughout this discussion this morning. We're also joined by Dr. Jeff Burns, as you saw, the co-director of the KU Alzheimer's Disease Research Center. Thank you for being here, Dr. Burns. And we also have neurologist Dr. Ryan Townley. Thank you for being here.
Yeah, thank you.
Nancy, how are you doing? Because an Alzheimer's diagnosis can rock a family.
I'm doing well. I feel like I've come to much more peace with the diagnosis than I had done, and in the journey that I'm on, I've decided that my mom's dignity is probably the thing that I'm going to honor, instead of my caretaking of her. That while I of course want her to be safe and cared for, that I'm gonna choose that she gets to choose.
Well, that's taking care of her.
It's a tough choice to make.
Yeah.
Though. So yeah, so far so good.
And how's she doing? What's her name?
Her name is Joan.
Joan. Okay. Where
Joan
does
Jackson.
Joan's in Salina.
Joan is in Salina.
Does she live on her own still?
She does. So she and her husband are on their much beloved place in the country, and that causes their children a great deal of stress. But they
Because she's still living out there on her own with her husband. Yeah.
Yes, and they love it.
Tell us more about what she's like, because you are so active and you have an aura of you have a spirit about you. Is your mom like that? What's she like?
She's kind of a ray of sunshine. My mom is one of those people that kind of never knows a stranger. She is as friendly as she can be. She's funny, she's kind, she loves to entertain, and she used to be a huge reader. She isn't reading as much anymore, and she loves, though, to sit in her living room and just look at birds, and she said that she'll just look outside and appreciate what she sees.
Oh, I love that. And you know, you look a lot alike. You have the same smile.
Thank you. I definitely take that as a compliment.
It's nice when people can say that. Your mom's diagnosis was 2 years ago. Dr. Burns, your Nancy's mom's doctor, Joan's doctor. What prompted you to get her evaluated? What were the signs you were seeing?
So we had been seeing some memory slippage for a while, but when we asked for the appointment with Dr. Burns, it was because she had had an acute episode where it was almost stroke-like symptoms, and we actually admitted her to the hospital. It had not been a stroke. We didn't know what was happening, and so we sought an appointment at memory care.
Dr. Burns, could that have been sundowning? Because when my dad was first diagnosed with Alzheimer's, he had this episode where we thought he was having a stroke, and we called 911, and it turns out it was sundowning, and we had no idea what it was.
Yeah, certainly. I mean, could be a lot of things, and stroke is the important thing to rule out. But
and that was ruled out.
It was.
Yeah.
Yeah, but there can be a lot of sort of acute changes from things like somebody gets a little sick or has a really bad night's sleep or something like that. If they're having memory issues, those can be accentuated and come out and appear to be something like a stroke.
It's super scary.
It was.
When that happens.
It really was. And she had a fall, and she was really struggling to put words together. Her memory took a huge dip, and then came back in little bits, but really never came back as fully. She never came back to herself the way that she had been before that episode.
That's rough. Real quick, to explain to our audience what sundowning is, it's when the sun goes down. And if you have someone with Alzheimer's, they really start behaving differently, especially if they've had a bad day. He would start wandering and almost hallucinating. Am I describing it correctly? Yeah. And no one really knows why. Do you know why that happens?
Well, I bet Dr. Townley can tell us more. But,
okay.
But,
Why does that happen when someone with Alzheimer's, when the sun goes down?
Right. Yeah, I mean, part of it is the brain is vulnerable, right? So I think that's one thing that we learn with these. It's almost like a cognitive stressor is applied, right? And so the more fatigued you are, the more tired you are, right? So if you had a bad night's sleep, you've got a cold brewing, right? Some sort of infection brewing, even as simple as a UTI. Could have a lot more confusion because it's kind of testing that brain out, right? It's like a stressor to the system. Whereas kind of end of the day, your brain's been working all day. There's probably more fatigue involved. So.
My dad had a sense of humor, so we would say, "We got to eat dinner early, Daddy, or you're going to turn into a werewolf again." And he loved that. He thought that was so funny, but it's really scary when that happens. So Nancy, you're doing all the things that they tell us to do when someone in our life has Alzheimer's. Nancy's exercising, sleep, diet, meditating. Dr. Townley, what has research shown on those things and why they help stave off Alzheimer's?
Yeah, no, I think you're doing all the right things. So we've kind of tried to package together our own program here at KU. We call it the LEAP program. We're going to talk about that a little bit. But The key ingredients being, probably if I had to rank them, because we should talk about that a little bit, I always tell patients, if you're trying to focus on one thing first, I'd say the exercise component is the biggest one, right? So when you think about how these are different pillars of brain health, the exercise is the biggest pillar.
What's it doing, the exercise doing to your brain, though?
Yeah. I mean, part of it is from a vascular health standpoint, right? So you're getting better blood flow to the brain, you're improving kind of the natural hormones that get released that help keep our brain healthy and active as we age. And so some of it is like, we literally call them exerkines. You exercise, you release some things, and it helps the brain out. So that's also part of the picture of what exercise does.
Like cleaning the brain?
Well, I kind of think of it as kind of like, is it keeping the brain strong in the setting of changes, right? So it might not always prevent the changes themselves. Some of it might, but some of it's just like, how do we build routes around the traffic jams that are building up in the brain?
Oh, that's good. Keep things flowing. Dr. Burns, we had one of your teammates on last year, Dr. Geiger, talking about her research with hot tubs and how hot tubs helped with cognitive abilities. Does the sauna time that Nancy is spending also help in the same way?
Yeah, we think so, and we're studying it. We've got a lot to learn there, but heat therapy, sauna, hot tubs have an impact on the vascular system. Dr. Townley was just mentioning that. So it has an impact on your blood vessels, and it does some other things that we don't quite understand very well, but it has an impact on your glucose and your insulin as well. And so we're trying to understand, all right, if we do this, and we actually have a 10-week study where we have people coming in and sitting in the hot tub, I think 3 days a week, 3 or 4 days a week.
That's a good study.
Yes.
I like that.
Yeah, right? Would you like to do that study?
And you're doing it on yourself, and it can't hurt if you stay hydrated.
Yes.
And it may help.
That's so great. Dr. Townley, creatine is having a real moment. It's all over the news as how it helps the brain and how it, there's been a flurry of news reports talking about how it can help stave off Alzheimer's. What does that do for your brain, and how is the dosage different than what an athlete would take?
Yeah. I think like from a supplement standpoint, right? Creatine is one of the most studied supplements kind of that we know of over the last 40 years. So we know most of it from the health and exercise and muscle gains that it provides, but it does seem to be healthy for the brain too. We're actually actively testing that. So some KU researchers are doing these studies, and so it's very exciting. Dr. Matt Taylor and his team are doing some of these studies. As far as the dosing and things, we need to learn a lot about that. I did kind of look into this a little bit. The 5 grams that most people take, that's usually to saturate the muscles. So you might need a little bit more than that, but that's what we're testing. Is there a dose-dependent thing that helps the brain more than just the muscles?
We recently talked about it on one of our programs, and that's why I started taking creatine. The 5 grams of it. Do you take creatine too?
I did just start taking creatine.
We need to compare
coffee
notes
in the morning.
Yes, it's kind of chalky, so I'm trying to figure out the right mix of it. How did you know what supplements to take?
So I did a blood test, which Dr. Burns later said he would not necessarily have advised me to take because I wanted to know if I had the genes that predisposed me to Alzheimer's.
Yep.
And the blood test was created by one of the doctors at the Cleveland Clinic, and the company is called Function, and they do 100 different blood markers, and you can sign up for others, and I did for the APOE gene. That sort of blood panel suggested a number of supplements, most of which actually were to reduce cholesterol, right? And because that is one of the biggest things that can be done also to help with Alzheimer's risk, as I understand it. So,
are you comfortable sharing the result of your blood test?
Yeah, and so I have always had just genetically high cholesterol, as my mom did, right? So this is a thing that I really worry about. And the good cholesterol has always been really high as well. And so my doctors always said, oh, don't worry about it. The ratio is really good. Your heart health isn't in danger. But now I am really concerned because the small particles, which I know I need to worry about now for Alzheimer's, are higher than I want them to be. So this is the thing that I know I do need to focus on, and I don't totally know how to yet.
Right,
So.
and you guys are figuring that out.
Yes, we're working on it.
You never recommend taking the APO3 gene test, and I did the same thing. I took it. I said, I don't care, I want to take it. And then the doctors will say, but it won't tell you if you're going to get it, but I took it.
Yeah.
I was glad to know I didn't have it. And then I was disappointed because the doctor at that time, we were living in another state, said, well, that doesn't mean you won't get it. And so what's the point of the test if it doesn't really determine if you're going to get it or not?
Well, this is why we generally say it's not worth doing it. You know, you can do it, but it can create a lot of angst without a lot of action. And you know, it's hard to interpret. And you know, if you carry the E4 gene, you're at higher risk. Which
And you carry that
you carry
copy,
on one
not
side.
two.
You already knew you were at higher risk because family history means you're at higher risk. So it doesn't provide a lot more information. And then the key is, it doesn't mean you're destined for it. 25% of the population have the E4 gene. So, you know, and not everybody gets Alzheimer's who has it, and you don't need it necessarily to get Alzheimer's. So this is where it gets confusing to how do we interpret it, you know, what do we do with the information? And it can just create angst without benefits. So for some people, and I did mine as well.
Do you have a family history of Alzheimer's though? Is it
kind of? My grandmother had issues late in life. I did mine. My Russ Swerdlow, our partner in running the center, would if he even thinks about getting it, he gets nervous and anxious.
Right.
And so it comes down to a little bit your personality, but you want to kind of be prepared before you do a test like the ApoE test.
Yeah, I didn't prepare. I just did it. I went to an independent lab and did it. And I remember my husband was like, are you sure you want to do this? I said, no, but I'm doing it. And it didn't help to know anything. What about, Dr. Townley, environment versus genetics?
Yeah.
An environment including all the things Nancy's doing.
Yeah, no, I think you could think of kind of an analogy, right? Like the genetics that you have are kind of like the cards that you're dealt, right? So you can't really change that, at least not right now. In 2025, we can't change that, right? But how you play that hand, right? How you, manipulate the game in a way of, am I getting the right variables of the environment right? Because we can see cases where literally genetically identical twins, same brain, same genetics, but one has amyloid pathology building up at age 50 and one doesn't. And what's the difference between that? It's the environment part, right?
Okay.
So that is an important thing to think about. I mean, as Dr. Burns talked about in the lead-in, about 40 to 50% of at least dementia cases could be prevented or slowed down from the environment side of things. So I think we have to think about genetics. That is sort of that hand we're dealt, but then how do you, go about that in life, and how do you modify that?
I just want to say, Nancy, you're doing all the right things.
She's killing
I'm so
it.
amazed with that lead-in was very impressive. Congrats.
You're doing everything. You also wear a ring when you go to bed, right? Okay, that ring is beautiful, but what does it do? If you would you mind holding up your hand and showing our audience? Or we've got video of that. Okay.
Yes.
That's not Nancy's hand.
Not my
That's
hand,
a man's
that
hand.
is the ring.
Okay, so what's the deal with this ring? What's it called?
So my particular one is called an Aura ring, but there are many different versions of it, and it basically tracks just like that's the app that I use. And it tells you what your sleep was like. That was embarrassing because on the particular day, my sleep had been horrible. But
it's not really your fault. You can't be embarrassed about your sleep.
I know, but I did feel silly.
Okay.
But this has been probably one of the biggest game changers for me because sleep is so important. You talked about your brain cleaning itself out, and we know that happens during deep sleep.
Yes.
And I hadn't been getting nearly enough of it. And this is just such a great little tool to look at what your habits are and when you're getting enough really good deep sleep and when you're not. And so it has caused me to just be much, much more mindful about my habits so that I'm getting a lot more deep sleep. And
so helpful.
By itself, I feel like I am doing better by my sweet brain.
You're controlling the controllables.
I am.
And that's a lot. I wear a watch to do the same thing.
Yes.
Smartwatch track my sleep.
Exactly.
Dr. Townley, Nancy's in her 50s. So what are some signs that people in their 50s or 60s need to watch out for if they are concerned about dementia or Alzheimer's in their family?
Yeah, that's a good question. I mean, the difficulty of knowing what is normal aging or not. We're all going through this for the first time, right? So like at an individual level, we don't exactly know. Obviously talking with friends, we all experience some of these walking into rooms, forgetting why you walked in there. You think about the how difficult it is to think of that name at the grocery store, right? And I like to use the analogy of like, you build up a larger library as you get older, right? So it takes you longer to find that book or name that you're searching for. So we all go through that. But when it starts to interfere with your day-to-day, right? When it starts to, now I no longer can do the things that I used to do cognitively, right? That's where we start to get concerned. I think one of the difficulties with studying Alzheimer's disease, though, is there are changes happening in the brain years before symptoms are like totally noticeable, right?
Right.
So you actually have to lose a certain amount of neurons before we can make a diagnosis in the clinic, and that's where we really need to move the science forward with biomarkers and other things to be able to diagnose things even before symptoms.
Before the symptoms, because you can do more. When it comes to symptoms about the brain, Dr. Burns, I'm sure you remember, there was a time about a year ago where I was texting you probably every month because I was worried about brain fog, and I was really obsessing because my dad was in the throes of it. But then you reminded me that unfortunately I was in menopause, and that was the brain fog. Do you get that a lot?
Sure.
And by the way, how cruel that Dr. Burns had to remind me I was in menopause. Thank you for that. No, tell us about the menopause connection, because a lot of women in their 50s, late 40s are thinking, oh gosh, I have these symptoms.
Yeah, I mean, well, one, brain fog and these cognitive symptoms are complex, and a lot of things can cause them. So we need to think that through when we're seeing somebody. And a key, as Dr. Townley mentioned, is it interfering with daily function? Is it really having an impact on your day-to-day? And if family's noticing that, or you're noticing that, that's when you want to get evaluated. And brain fog's common. It can be a bad night's sleep. It can be menopause. So there's a lot of changes happening, hormonal changes happening, and that has an impact on the brain. We're actually studying it. We need to go a lot further.
You need more women in menopause?
We are looking for women.
All right,
in
I'm going to talk to you after the program and sign up for that.
Amber Watts is running a study out of Lawrence with us, and yeah, so that's a big study that we're doing to try to understand the symptoms and the changes that we see in terms of cognition across menopause. It's
so tricky because grief can also trigger similar symptoms of the brain fog. So you've got women in their 50s are seeing their parents go down this road. They're getting hit with menopause. They're also grieving. Am I speaking to you about this? That can affect everything, and then it's cruel because you think, is it happening? Is it happening to me? We love your questions and comments, and we're so grateful to have Nancy on the show. So if you have anything you'd like us to read out loud on the program or have us ask the doctors, just send it to us on YouTube or Facebook. You'll find all the links on how you can connect with us right now in real time. Nancy, we know you've undergone genetic testing. Dr. Burns, when it comes to genetic testing, is there any kind of test that you would recommend? Because you don't recommend genetic testing yet.
Yeah, I mean, there are some situations where we do it. For people, we're thinking about the new drugs for Alzheimer's disease. We will get the ApoE test on them to understand their risk. It helps us understand how risky the medication is.
Okay.
Yeah, and if somebody's really curious and they're well prepared and they've talked to somebody about it, then it's you can do it. But I think come back to what's the purpose of doing it. So it's complex, and it is available. You can get it. You can get it online, and find ways to get it. But I would talk to somebody and really do your research first.
Right. Don't just go get it willy-nilly.
Yeah, I think I'll add to that some of the complexity is the healthcare system environment. So there can be long-term care insurance implications of genetic testing.
Yes.
So these are things that you do have to be aware of and mindful of before you have that enter into your medical record, right? So, but for some people, that can be the motivating change they need. I mean, I have a family history, and it's something I've thought about. I just pretend I have it. I pretend I have the risk factor gene. As Dr. Burns said earlier, if you have a family history, your risk is about very close to the same as if you have one of these gene risk factors. So
you do what Nancy does.
Yeah,
that's how you just live like you might.
But if somebody's not motivated enough without that test, maybe that's the test that sparks the fire, right? Yeah. So.
What is the Brain Health Boot Camp, the Alzheimer's Disease Research Center Brain Health Boot Camp?
Yeah. Well, so Dr. Townley mentioned our LEAP program.
Right. Is that the same thing?
It's a product of the LEAP program.
Okay.
Yes, it's our Brain Health Boot Camp talking about all the things we're talking about and how to kind of put it into action. So we do it, it's a virtual program. Occasionally we do an in-person program, but I think we're in the middle of running one right now or near the end of one. So you can look for us online at the KU Alzheimer's Disease Center website and look up LEAP. And yeah, it's a great way to sort of get the basics and then get some tips and advice about how do we sort of bring this into our lives, like the way Nancy's doing it.
Do be like Nancy.
Be like Nancy.
We already, I mean, you're really, and you're honoring your mom in such a beautiful way by doing this.
Thank you.
We have some great questions coming in, so if you have any questions or comments, send them in, because we're starting to ask the community questions right now. Let's see here. Jill wants to know, how much weight is in Nancy's backpack and how far are you walking with it?
It's 20 pounds, and my goal is to increase it to 40 pounds, and I'm currently walking between 2 and 4 miles whenever I go.
You'll see women all over town with
everywhere.
weighted vests on. I wear mine to the grocery store everywhere. I'm like a lunatic with that thing. Jeremy Yenser wants to know, what are the things we still don't understand about dementia that you're trying to figure out? Who wants to take this one? Dr. Townley.
Yeah, I'll take that. I mean, I think, like I said earlier, a lot of what's happening in the brain, I describe it kind of like an iceberg, right? There's like all this stuff that's happening under the surface that we have no idea about, and then there's like what we can see, and usually that tip of the iceberg isn't even exposed until one of these cognitive stressors, or after surgery or after some sort of major life event, right? When there's a cognitive stress test applied to the brain. But I think of dementia as sort of a multi-hit hypothesis, right? I mean, we have genetics, we have environment, we have other things that are happening to the body and the brain as we age, right? And so I think that's where we really need to understand, like, at an individual level, what is one's risk, how to prevent it, but then also, even if we do identify that Alzheimer's is happening, how to prevent that dementia part, right? Because that's the key thing, that we really want to keep people independent and stay in mild stages as long as possible. So I think that's really the key of what we need to learn.
Sally has a question about social connection. She heard that that's important to brain health. How does social connection help? Dr. Burns?
Yeah, I mean, staying connected is important. There's a lot of data.
Just going to parties, going out with your friends.
Yep, having a social network and sort of working at it, not withdrawing and getting isolated. But it's probably brain activity. Keeping connected means you're socializing, you're talking to people, and you're keeping, you're stimulating the brain through those connections.
Alice has a question. She writes, this is a good one because I read about this. I recently read that the shingles vaccine can help prevent Alzheimer's disease. Is that true, and why? Dr. Townley?
I'll add to my last answer. So that's a good segue of, it's like, that's another thing, a stressor to the system, right? So if you get this shingles, reactivation. So we all have this virus living in our cells, and if you get this reactivation of infection, that's inflammation, that's reaching the brain. So the shingles vaccine try to prevent that infection is part of the key. So we see this in a lot of studies. COVID is a major stressor to the brain, right? So we see if somebody gets a pretty bad bout of flu, they get pneumonia, they get hospitalized, their risk of dementia over the next couple of years is higher. So all these vaccines are really trying to prevent the severe infection, right? And that's what the shingles vaccine is doing.
This is such a great discussion. I wish we had more time to do this. If you have any more questions, feel free to keep sending them, and I'll make sure to get them to one of the doctors for your answers, because I know this is such an important topic. For today's takeaways, Nancy, I want to start with you, because you're on this program and you're very openly sharing your journey to honor your mom, and it also is helping so many other people. What do you want to say to other people watching with a loved one who has Alzheimer's?
I think the biggest thing, for me, again, my first instinct was kind of command and control. What can I do to take care of mom? And I still, of course, want to take care of mom, but in that journey, what I've been trying to do more and more and more is listen to mom and ask her questions and include her, and making sure that her voice is heard and that her dignity is intact, because what I've seen is that that's actually the first thing to go, and that she maintains her sense of herself, and that I help her to do that as fully as I can. And while I am on this journey to stay as healthy as I can for as long as I can, that I make sure that she knows that it's not because I'm scared of becoming her. It's because I want to honor her, as you just said, you know, by staying as healthy as I can for as long as I can.
How can people best support someone with Alzheimer's? What do you wish people knew? How would they best support Joan?
I think to just be involved in knowing everything that they can. I mean, I raise money for the University of Kansas, and so every time that I talk with these guys, I want to go out and raise money for this cause. And so, you know, if you feel moved, anyone, to give money for Alzheimer's research, I am profoundly passionate about that. I think beyond that, to just be active in talking to people in the community and making sure that if you know anybody, if there's anybody in your family who is maybe showing signs, that they get tested. Because the earlier that we know that people have this disease, the better they can be treated.
Absolutely.
And there are treatments now, and there didn't used to be, and that is hope, and that is really thrilling.
Like any disease, it helps to get tested. It's the one disease people are ashamed of.
Yes,
And they absolutely have no reason to be ashamed, but they resist getting tested because of that. And you wouldn't do that if you thought you had cancer, right?
100%.
It's a very strange thing that it does to us. Dr. Townley, what do you wish viewers knew?
Yeah, I think from just kind of what Nancy said, the idea of picking up things early, right? So like, you know, our treatments right now that we have work best at the earliest stages that we can detect and diagnose. But that's also where our research is going to be most beneficial. So we really need research participants in our studies at the mildest stages. That's always the hardest to recruit, because telling the difference between normal aging and not is already difficult in and of itself. But then for someone to go and get tested, like, you know, I think part of the misnomer as well, I'll wait until it's X, you know, level of difficulty with my daily tasks before I go get evaluated, and that's the wrong time, right? I mean, you still have to do it, right? But we're not going to be able to bring brain cells back, and so the earlier the better.
Right.
Really the thing to take home.
Dr. Burns, everyone's always asking you, when are we going to have a cure? So we know you don't have that specific answer, but what do you need more of to get to that point?
Yeah, well, I mean, we're making strides.
Yes.
I've been doing this 20 years, and the work's finally starting to pay off. The dividends are arriving now. We've got the new blood measures, we got the new drugs. Early diagnosis is important. Go back to what Nancy was saying. We need advocacy. Now's not the time to take our foot off the pedal.
Right.
And some of that's kind of happening, and it's a threat to us moving forward. You know, we need people fighting for research and for science and for moving it forward, because we are making big strides forward right now, and there's a whole lot more we have planned, including prevention and curing this. And I think we can do it. I don't know when. I think we will do it, but you know, we don't know when. But we're going to do it with a multi-pronged approach, and you know, starting real early before the onset of symptoms. And so that's in the future. It's a matter of, you know, when, not if. And so advocating for the research and helping us push it forward is so important.
When, not if.
Yeah.
Thank you so much for all the work you do for Alzheimer's disease research. Dr. Townley, thank you. And Nancy, thanks for sharing your story with us and telling us more about Joan. I wish I could meet her. I hope you bring her, when you come in for an appointment next, will you bring her by?
I will do
I would love to meet Joan. And thank you to our guests for joining the conversation. Our viewers, thank you to our viewers as well. We will see you right back here tomorrow for Open Mics.
A young woman thought she had a simple infection, but it was breast cancer. I'm Jessica Lovell on the next Open Mics with Dr. Stites. The lifestyle choices she thinks played a role in her diagnosis, Wednesday at 8.